Hi, this is Navpreet and I'm a student nurse today. So I'm going to teach something about the Reye syndrome. So basically I'm going to teach something about the Reye syndrome, like what Reye syndrome is, what are the causes, the signs and symptoms, the risk factors, the treatment of Reye syndrome, and what are the diagnostic tests, treatment, and then the patient teaching. So firstly I'm going to start with what the Reye syndrome is. Reye syndrome is an acute non-inflammatory encephalopathy, that's the pathology of the brain, and the hepatopathy, that's the pathology of the liver, that follows a viral infection in children. Like this syndrome happens basically in pediatric population, like in children's. So there may be a relationship between the use of aspirin, that's the acetyl salicylic acid, during a viral flu or illness like chickenpox, and the development of Reye syndrome. Like this syndrome happens when the patient took aspirin, then this syndrome occurs. Like in this syndrome, the patient's brain and the liver infected the most. So for this reason, aspirin use is generally contraindicated in the pediatric population. In the Reye syndrome, a child's blood sugar level typically drops while the level of ammonia and acidity in his or her blood rise. At the same time, the liver may swell up and develops a fatty deposit. Swelling may also occur in the brain that causes seizure, convulsions, and loss of consciousness. So this syndrome happens due to the use of aspirin in pediatric population. So the signs and symptoms include lethargy, irritability, vomiting, confusion, and seizures. And the main causes are the liver dysfunction and cerebral edema. So when there's a liver dysfunction, the sign and symptom is vomiting, and when there's a cerebral edema due to the Reye syndrome, then the signs and symptom is lethargy, irritability, confusion, seizures. And the labs that basically increases is the AST, ammonia level increases, and the coagulation time also increases. And the diagnostic tests are liver biopsy and the lumbar puncture. So now I'm going to teach about the following factors usually when occur together may increase the child's risk of developing Reye syndrome, and these are using aspirin to treat viral infections such as flu, chickenpox, or an upper respiratory infection, having an underlying fatty acid oxidation disorders. And now I'm going to talk about the nursing care. Nursing care is providing hydration, like IV fluids, and restrict the input and output, like use the catheter, and make sure the head of the bed, like the patient is laying, is in 30 degrees, and administer pain medication, and because the coagulation time increases, administer the vitamin K, and use the proper seizures precautions, and assist with intubation if needed, and proper education of the family members because it occurs in pediatric population. So we have to proper teach the patient, the family members of the patient, and administer mannitol, which decreases the cerebral swelling, and then observe for increased intracranial pressure. So the goal of treatment include reducing intracranial pressure, maintaining a patent airway, because in this the seizure also occur. Then make sure the patient is laying on the floor, and make sure patient is not in the suffocated area. Make sure take proper precautions for the seizures too. Maintain a patent airway, cerebral oxygenation, fluids and electrolyte balance. Make sure about that, like proper hydration, hydrate the patient well. Frequent assessment of vital signs and a careful assessment of neurological status as are essential. Observation for signs of bleeding is important because liver dysfunction causes blood clotting abnormalities. So parental education and sports are necessary. Encouraging patient to participate in the child's care help to reduce the parents and child level of anxiety. So the tests include lumbar puncture and the liver biopsy. So now this is the I covered the treatment. Now I'm going to discuss about the after recovery. What we need to do is avoid the use of aspirin. That's we're gonna teach to the parents of the patient, like avoid the use of aspirin if the child develops any flu-like symptoms, or make sure to contact with the doctor and do not use aspirin. And read labels carefully for the presence of salicylates. So make sure, read the labels. If there's the use of salicylate, do not use that medication. Make sure do not use salicylates because they causes Reye syndrome, affect the patient's brain and the liver. And patient may have long-term neurological damage, and we need to assess that neurological status too. And that's all about the Reye syndrome. Make sure do not use aspirin because aspirin is the main cause of the Reye syndrome in pediatric population. Thank you.